Hi, I'm Deb Bruner. I'm the contact PI for the NRG NCORP. Welcome to the July 2020 meeting. Hopefully this is the last fully virtual meeting, and by next February, we'll get to see you all in person again. The NCORP PIs are myself and Dr. Walker, and the associate PI is Lisa Kachnick. I'd also like to recognize our administrative support, Erica Field, who we could do nothing without. She is the glue for all of NRG NCORP. We'd first like to start with congratulations to our new CTEP group lead, Dr. Quinn Lee, who was appointed as one of our 3 oncology group chairs effective as of July 1st. Dr. Lee was, prior to this appointment, served as the NRG Head and Neck Cancer Care Committee Chair. We'd also like to announce some changes in our Cancer Prevention Committee. Dr. Doug Levin is stepping down from NCORP to begin a new journey and career in corporate America. He served as our cancer chair for cancer prevention for 1.5 years and oversaw the development of our large self-injectomy trial, NRG CC008, which was activated just in June of last year. He is being replaced by Dr. Warren Yu. Welcome, Dr. Yu. Dr. Yu will now be co-leading our NRG SOCROC self-injectomy trial, and Dr. Yu is from the University of Alabama. I'd just like to recognize the fact that we have 36 NRG NCORP members, which is 78% of all NIH, NCI, and NCORP members. And welcome to all of you that are attending today. We have 6 open NRG NCORP trials. The first 3 are listed here. We have 1 legacy cervix trial, which is looking at physical function and quality of life. And that is due to complete accrual by this December. We have 2 neurocog studies, one that will be completing accrual in February 2022. It's a lung trial looking at PCI versus PCI with hippocampal sparing for neurocognitive function. We have a cancer care delivery trial. It's a survivorship care plan for prostate cancer survivors who receive androgen deprivation therapy. And we're doing very well with accrual there. 100% of the patients are NCORP. We have 3 other trials. The Forte trial, which will be activating soon, this month or next. Very large 9,500 patient trial looking at 5 versus 10 years for colonoscopy. We have NRG CC008, which I just mentioned. Both of our cancer prevention past and present chairs are involved in. And that's the non-randomized trial looking at self-injectomy compared to self-injectomy oophorectomy for those at risk for ovarian cancer because of BRCA1. And we have a trial, again, looking at neurocognitive function, which is looking at stereotactic radiosurgery versus a whole brain radiation. And this opened in February of 2021 and will go through 2024. We have 2 studies that have been approved by our NCORP steering committee. One that is under R01 resubmission. It's looking at the microbiome and symptoms in gynecologic therapies. And the other is going to be reviewed this month by the NCI Quality of Life Steering Committee. And that's the Ed Tanner study looking at the impact of sentinel node, lymph node mapping on extremity limb dysfunction and endometrial cancer. This meeting will be reviewing at our NCORP Thursday night reviews 2 trials, one looking at exercise and the other looking to improve young breast cancer survivorship by use of mindfulness awarenesses practices. Just to remind everyone that we have 60% of our CTEP trials, mostly phase 3 trials, that include patient-reported outcomes. At every meeting, we like to send out a reminder about how important these outcomes are, how important compliance with these outcomes are, And many of the times when treatment outcomes, survival, for example, are equivocal, it is these outcomes that help us make a decision about change in practice. These have become more and more important as the years have gone by, and we really appreciate your help in doing all that you can to ensure compliance with the time points for patient-reported outcomes. To give an example of our NRG NCORP impact, we've had multiple trials that are changing clinical practice. And just since our last meeting, we've had multiple publications. I couldn't even show all the abstracts. We have, fortunately, so much going on this year. Very proud to announce some of the publications here, just a smattering. Dr. Small's trial building on 0841, which looked at psychological treatments for patients receiving radiation therapy. Dr. Weffel and team looking at neurocognitive symptom management and health-related quality of life. Dr. Gans and team looking at the large NSABP B47 trial and menstrual history and the impact on outcomes. We have Dr. Garzai's study looking at physicians' attitudes regarding omission of surgery among responders for neoadjuvant systematic therapy for breast cancer. And we've published on Dr. Wenzel's study with the quality of life and adverse events showing that quality of life, again, is prognostic in terms of ovarian cancer survival. Another major impact is that the NRG NCORPs contribute at least a third of accrual to NRG treatment trials, not just our NCORP trials. I'd like to give a major shout out to our NCORP sites, those who have been major accruals to both our NCORP DCP trials and our CTEP treatment trials. First, we start with our DCP trials, and these top accruers for this round are Geisinger Medical Center, Upstate Carolina, both the ANMed Health Center and the Spartanburg Medical Center. We also would like to commend Dr. Chen, who's taken over the University of Kansas, Masonic Cancer Alliance Rural NCORP, and the Maine Medical Center, the Bramhall campus. The Upstate Carolina gets the gold star for DCP trials since they have two sites, both in the top accruals. As far as top accruing NCORP sites for CTEP, we have the Bon Secours site, the University of New Mexico, Helen Graham from the Delaware Christiana NCORP. We have the University of Kansas again, and we have for the first time our Puerto Rican site. Many congratulations to all, especially to the Kansas site, who was in both the DCP top accruers and the CTEP top accruers. Well done, Dr. Chen and team. Now for some breaking news. We'd like to announce our NRG NCORP pilot grant awardees. These are always very popular, and we're using this as a pipeline to bring them in to NRG NCORP concept development. So our NCORP Cancer Care Delivery Pilot Project awardees are Asama Shakat from the University of Minnesota, looking at boosting colorectal cancer screening through proactive outreach in Native American communities, and Dr. Gretz from Emory, who's looking to leverage mobile health to improve oral chemotherapy adherence among women with non-metastatic triple negative, and we know how important that is, breast cancer. Our health disparities pilot awards go to Dr. Chin from Columbia, looking at breaking down sexual health barriers in underrepresented female cancer patients receiving pelvic radiation therapy, and Tamara Watts from Duke, who's looking at understanding how HPV virus serotypes impact racial disparities in head and neck cancer. We just would like to mention that we will be taking individual NCORPs to spotlight them in our upcoming newsletters each month. If any of you are interested to participate, we can connect you with Erica Field, our NRG administrative coordinator and support. She will be happy to work with you, or we will be reaching out to you based on some best practices related to accrual or minority accrual. Finally, I'd like to quote Benjamin Franklin, who says, "Well done is better than well said." My words here are nothing compared to the fantastic work that all of you are doing on behalf of patients with cancer through the accrual to NCORP and CTEP, cancer control and prevention, cancer care delivery, and cancer treatment clinical trials. Thank you.